Hello, this is Dave Maddock at Maddock and Associates, here to do a webinar about patient-centered outcome research fee. Thanks for joining us. So during this presentation, we're going to talk about what is the PCORI fee, who needs to pay the PCORI fee, how to determine what the fee is, and how to pay the fee. Just to recap, Maddock and Associates, we're an independent insurance broker, been in business for 40 years. Maddock and Associates, we work with small businesses up to 500 employees and help them manage their employee benefits. That includes getting the best value for their employees and the company, staying on top of all the healthcare reform regulations, and then just making sure the plan goes smoothly by helping resolve claim issues, answering questions, and doing an excellent job educating employees on their benefits. More information about us is at maddockinsurance.com. So disclaimer before I get started, Maddock and Associates is not a tax accountant. This presentation is for information only and is not tax advised. Each company has different facts and circumstances which may not be addressed in this presentation. Make sure to consult a tax accountant before filing any tax documents. So what is the PCORI fee? The PCORI fee was created by the Affordable Care Act, also known as Obamacare, and essentially it establishes a research fund, a tax to fund research to focus on the medical insurance industry and medical care delivery industry. So part of Obamacare, they want to look at improving the healthcare system. So this tax funds research to do that. The tax started October 1st, 2012, and then it's supposed to end at October 1st, 2019. Every year, the fees are due July 31st. So who needs to pay the fee? Basically, all insurance policies, medical insurance policies need to pay the fee. If most of the time or all the time for fully insured plans, the insurance company pays the fee. So group medical or individual plans, the fee is just built into the premium and the insurance company handles remitting the fee to the government. Where the employer gets involved is if you have a self-insured plan. That's also could be called a level funded or RISA plan. And you know you're on a self-funded plan if you're getting claims experience and you're due for a potential refund or credit at the end of the year if your claims are good. Also, health reimbursement arrangements and flexible spending accounts are required to pay the PCORI fee. Health reimbursement arrangements are very popular. Most groups that have health reimbursement arrangements set them up to help reimburse employees for part of their insurance deductible. So a real common situation is an employer has a $1,000 deductible and they go to a $2,000 deductible to save money, but they set up a health reimbursement arrangement to reimburse employees the difference between the $1,000 and the $2,000 deductible, keep the benefit the same. So if you've got a plan set up like that, it's called a health reimbursement arrangement generally, and you're going to need to pay the fee. Also, flexible spending accounts, those are plans that allow employees to set aside tax-free money to pay for medical expenses. One thing on that is confused with these sometimes is health savings accounts. Health savings accounts are not required to pay the PCORI fee. So anyway, if you know someone has a HSA or health savings account, just that and alone doesn't make them have to pay the fee. They potentially could have an HSA and an HRA. It would be the HRA that would trigger the fee. Questions on what type of plan or if you need to pay the fee or not, definitely contact your insurance broker and we can help you out. So determining what the fee is, the PCORI fee is based on the number of members on the plan, not just the employees. So it's important that you've got to count the spouses and the children as well as domestic partners, everybody covered under the plan. People not covered on the plan don't count. The simplest way, there's multiple ways to come to count the employees. The simplest way I think is called the snapshot method. And so the easiest thing to do is just to pick a date in a quarter, the same date every quarter, like the first of the month. Calculate the member count for each quarter using that same date. And then the PCORI fee is based on the average. The tip, you can use your medical insurance billing statement to help you. Typically that's run on the same date every month, and so you could you might be able to use that information to help with your count. Also, that information might also be in your payroll system, or if you're on a self-funded plan, a lot of times a third-party administrator can get a report for you that has this information. So an example of somebody using the snapshot method would be an employer here where they're using the first of the quarter and their plan starts July 1, so they use July 1st, October 1st, January 1st, April 1st. That's 4 quarters. They add those up, divide by 4 to get the average of 88. So they're going to be their employee count using that snapshot method. So determining the fee, the PCORI fee uses, it's pretty confusing. The fees go up every October 1st. So the fee is based on when your plan ends in this October to September 30th situation, but the fee is due on a calendar year. It's pretty complicated. I get confused every time I try to explain it. So we've got a cheat sheet for you, and I'm going to link this. This is linked to the bottom of the YouTube, and I just recommend people use this cheat sheet when they're trying to decide what the fee is. So I'm going to pull that up right now. So this is going to be at the bottom of the YouTube. But essentially, one of our carrier partners, Cigna, put together this nice cheat sheet, and it goes back to from when the PCORI fee started. And basically, you can go and find your plan year, whenever it is. It's got every single year there is, and it'll show you what the fee is and when the fee's due. So the reason it gets confusing is, like you see here, November 1, 2013, if your plan started then and ended, in 2014, October 31st, your fee's higher than if it would have started a month earlier, but it's due the same time. So essentially the fee goes up every October. Plan years ending October 1, and then it's due on a calendar year basis. So like as you see, this one shifts over and it's due the next calendar year on July 31st. So as I mentioned, it's hard to just the best way to do it is use this cheat sheet. Then it's real simple. You find when your plan year is, I'll say when the fee is, what the fee is, when it's due. So back to the presentation. So when it comes time to pay the fee, you use IRS Form 720. And I've got a picture of the form right here. You're going to want to download this online. They change it periodically. But essentially, on the form, you're going to fill out the first part, just your employer information. And then you got to scroll all the way down here to part 2. And then this is the part, the PCORI fee. This is where you report it. So most everyone, you're going to use this line B, applicable self-insured health plans. This is where you got your average number of covered lives using the snapshot method. And our example is 88. And then the fee. It's either $2 or $2.08, depending on when your plan year ended. It multiplies those together and get the tax. This form is used for all sorts of different taxes and penalties. As you can see here, there's a tax for fishing rods. There's a tax to bows, quivers, points, arrow shafts, indoor tanning. So you're based on your company, you may be filing this form already for some of the other taxes involved on a quarterly basis. So that's why we really recommend this is a tax form. Have your accountant take a look at it before you send it in to make sure that you're doing everything correctly and that you're not missing something else. So the form, the 720, if you look at it, it says it's a quarterly form. But if all you're doing is a PCORI fee, you only have to pay that once a year. So you don't have to pay the PCORI fee on a quarterly basis. If you have some of those other taxes, like the indoor tanning tax, you may have to pay that quarterly. Like I don't even know. But anyway, it's important, like I said, work with your accountant just to verify that, hey, this is the only tax we're paying, or if you are paying other taxes, definitely want them to be in on that as well. And then you're going to add this one, the PCORI fee, once a year before July 31st. So any questions, we're always here to help you out. Maddock and Associates, phone number 800-875-4490, and Maddock Insurance, that's maddockinsurance.com is the website. Hope this is informational for you, and hope you have a great day.